Novel approaches to the treatment of anxiety disorders. There are two ways to neutralize fear conditioning. First is facilitating a process called extinction, or by blocking a process called reconsolidation. Fear extinction is the progressive reduction of the response to the feared stimulus and occurs when the stimulus is repeatedly presented without any adverse consequences. Rather than reversing the synaptic changes, a new form of learning with additional synaptic changes in the amygdala occurs during fear extinction. These changes can suppress symptoms of anxiety and fear by inhibiting the original learning, but not by removing it. This sets up a gate within the central amygdala, with fear output occurring if the fear conditioning circuits predominates and no fear output occurring if the fear extinction circuits predominates. The output depends upon which system is stronger, is better remembered, and has the most robust synaptic efficiency. Fear extinction appears to be more labile than fear conditioning and tends to reverse over time. Also, fear conditioning can return if the old fear is presented in a context different than the one learned to suppress, a process termed as renewal. CBTs that use exposure techniques come closest to facilitating fear extinction, but such therapies are often context specific and do not always generalize once the patient is outside. Thus, fear and worry may be renewed in the real world. Specific drug might also strengthen extinction learning by pharmacologically strengthening the synapses on the fear extinction side. NMDA receptor activation at the very time when the patient receives systematic exposure to feared stimuli, either with direct acting agonists such as D-cycloserine or with indirect glycine enhancing agents such as selective glycine reuptake inhibitors. During CBT, learning occurs because glutamate release is provoked in the lateral amygdala and in the intercalated cell mass at inhibitory GABA neurons by psychotherapy. If NMDA receptors at these two glutamate synapses could be pharmacologically boosted to trigger disproportionately robust long-term potentiation in synaptic plasticity, exactly when these synapses are selectively activated, it could theoretically result in the predominance of extinction pathway.